Well, I know you just wrote a book about this, obviously, so this is a big issue for you right now, but you've been talking about this for years. Do you think we're finally at the point, I believe the name of the book, Howard Dean's Prescription for Real Healthcare Reform. Do you think that we're finally at this unique point where it's not just that Congress understands, it's not just that the president understands, but I think as importantly, or maybe even more importantly, that the American people understand?
First of all, people ought to go out and buy the book since you gave me the opening, because it's 133 pages of plain English. And it was written along with Faz Shakir and Igor Volsky, who were terrific young researchers from the Center for American Progress, which is, I think, the leading think tank in Washington, certainly on progressive issues. And it's in plain English, but lots of statistics, how you can combat the right-wing myths, how you can organize to influence your senator and your congressman, what other countries have and what their shortcomings and their strengths are. So it's a nice, comprehensive, but very readable book, and I hope everybody runs out and reads it. Now, as far as the change goes, I personally believe that President Obama's approach is the best approach I've seen. And we were involved in the Hillary Task Force. I actually, as a medical student, came down and followed Senator Kennedy and Senator Javits around while they tried to put together a health care bill when Jimmy Carter was president. What Obama understands that we didn't understand before, or if we did, we didn't act on it, is that 80% of Americans have health insurance. And of that, 80% like their health insurance. So that's about 65% of the public that more or less likes what they have, even if they don't like the price, and 35% that doesn't. Well, in a democracy, 65% beats 35%. So what Obama has done is, instead of this debate being about the moral imperative to insure the uninsured, this is a debate about what's best for all of us, whether we have insurance or we don't have insurance, first. Secondly, as a country and as a people, every doctor knows that you never really make changes until the pain of staying the same exceeds the fear of change. And what the Republicans have done, to a lesser success this time than they did the last time, is try to crank up the fear. They're very good as an opposition party because they specialize in fear and anger, two negative emotions but effective in opposition. They've cranked up people's fear about what might happen. They have spun the American people around so fast that you get older people coming to these town meetings who are on Medicare who insist that the government not fool with their government planned health care. It is insane. But I think that we're at the position now where, as a society, the pain of staying the same is exceeding the fear of change. The subtitle of my book is something like what you can do to change healthcare and make our jobs safer. This is a jobs issue, not just let's do something for people who don't have what they should have, which is healthcare. This is not about every American has a right to healthcare. This is about how to have an economic society that works for us. And it turns out that if you don't have everybody in a healthcare system that makes some sense, our society becomes a second-class economic power.
Yeah, but you're now also talking about logic here. And what we've also seen most recently from the Republicans just down on the mall not that long ago with pictures of President Obama in Hitler mustache and the willingness to say, we're going to set up death panels and we're going to kill your kids and we're going to fund abortion and we're going to fund illegal aliens and we're going to fund this and we're going to make sure you're scared to death. That's where facts are essentially unnecessary. How do you overcome that?
Well, you don't have to worry about it. All you got to do is stand up. I thought Obama's presentation to Congress was brilliant. What people want, look, people don't know what the facts are. We don't all know the facts. How can we? What they want is strong leadership. President Obama supplied that. And since no Republicans will help get anything passed of any kind, he needed to unify the Democratic Party. He accomplished that when he gave his speech. All these lies that the right-wing talk show hosts and the right-wing politicians are telling, the public is not as affected by those as you think. The people are out there protesting in the mall. That's not about health care. That's about anger at a new generation's president, anger at the changes that happen when more people under 35 vote than people over 65 vote. I'll bet you not 5% of the people that came out on that mall voted for Barack Obama in the first place. And they're angry that he won. So that's a different problem than people who oppose health care. And the way and ultimately logic does win out if you're firm, if you're strong, and if you keep pushing and you don't give up. And that's why I think the public option is going to pass. I think that some of Barack Obama's staff wants to take a political look at this. I think Barack Obama, who is, in my opinion, extraordinarily intelligent, has figured out that the public option cannot be sacrificed.
Are you optimistic that this is going to pass? And if it is, will it pass this year?
It's going to pass. It's going to pass this year. I believe there'll be a public option. I think if there isn't a public option, it'll probably tear the Democratic Party in half, which is not such a good consequence. I think it will pass because otherwise a lot of people are going to lose their election. The other thing is I am now discussing with folks behind the scenes a way to make some of this enacted by 2010 election. It has to be. One of the things I discovered in the civil unions fight 10 years ago, even in a very progressive state like Vermont, people were really angry. Many of the same kinds of dynamics that we see going on today. People were convinced, lied to, that their children were going to be taught to be gay by the teachers union in the public schools. We laugh at that stuff. People believe that kind of stuff, just like they believe the death panels, right? Once the civil unions went into effect, lo and behold, nobody's marriage got ruined and the kids didn't come home and say, oh, I decided to be gay at school today.
Even in California, there were 45,000 married couples, gay couples, and this was even after they were fighting Proposition 8, and apparently California isn't falling into the ocean, at least not the last time I checked.
Right. So the point here is, once you implement something, all the lies go away. People are going to realize that if they enroll in this program, that their granny didn't get murdered by the government, that their children's abortion didn't get, on and on, the illegal aliens didn't get paid for, all that kind of stuff. And if it works for ordinary people, the anger goes away almost immediately. They're still going to be angry at Obama being president, but they didn't vote for him. But they can't continue with this nonsense that we hear from the right wing and Fox News and all this people, because it's not true. And there are actual real Americans, some of whom are coming to these rallies, who have benefited by the fact that we have a bill and it works. And in the election in 2010, people will be able to point to those folks and say, this works, see?
The name of the book, Howard Dean's Prescription for Real Healthcare Reform. Governor, thank you very much for joining me.
Jack, thanks for having me on.